You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, how to restore and maintain your youthful appearance. With us, we have an expert on the topic, board-certified facial plastic surgeon, Dr. Gregory Keller. Dr. Keller, always a pleasure to have you on the show.
Always a pleasure to be here, Randy.
Now, before we get into today's topic, because I guess there's a lot of new technology, new techniques that are, I guess, allowing for even more natural appearances for facial rejuvenation. But for those that don't know you, tell us a little bit about your practice. I mean, what kind of patients do you see?
Well, my practice is really all ages, Randy. I mean, we have the young girl who's interested in a rhinoplasty. We have people who want to maintain their skin and keep that in shape with its natural color, texture, and appearance. We have people who are a little older who want to do something about their eyes. We have older people who want to do and lift the face, which occurs mainly around the time of menopause, but can occur earlier. Mid-facelifts, there are all kinds of things and all kinds of ages that we deal with.
Let's begin with the younger patient. I mean, at what age are they coming in now to do things?
They come in at all ages now, Randy. You know, you'll have younger people with acne. We have devices that'll really help that and clear things up, whereas before Accutane was a necessity. People will come in when they start to notice pores or little wrinkles. And there are a lot of tools, Botox, intense pulse light, and the newer fractionated resurfacing devices that can really help that. These are things with minimal or little downtime or risk that can really make a difference.
Okay, now, do you think there's a benefit, and we talked a little bit about this off camera, of going to somebody that does both? When people ask me, I said, if you're going to go, and this is what I've learned after doing over 1,000 of these shows, is that go to somebody that both does facelifting, but also does fillers, and all the minimally invasive stuff. So that way they give you an honest opinion. They can't help but tell you what's best for you. I mean, is that the way you feel? Is that accurate?
There's an old saying on that, actually, that if you have a hammer, everything looks like a nail. You know, so if you have one thing to do, everything looks like that's what you ought to do. I think it's good to have a repertoire of things that you can fit to the individual patient and tailor for their specific program to maintain and restore their youthful appearance.
Okay, so it's not just all about adding volume, adding fillers. Because I have people on the show, let's say it's a dermatologist, that says it's all about volume. Add volume, you look younger. What are your thoughts on that? I mean, define the young, the youthful face. How do you keep it?
Well, you know, it's a variety of things. As we age, different things happen. The first things happen in the mid-face. The middle part of the face can sag. Can you cover that over with volume? Yeah, but you can also look like you have a rock in the sock type of appearance. So a little volume can be helpful, but it's also helpful to pick those fallen structures up. And if you get people early enough and maintain that, you can do that with a very minimally invasive type of procedure with new devices that Coapt and other people make.
Okay, so you do a mid-face. So now for nasolabial folds, that seems to be what a lot of women that we interview are worried about. Fillers, do you do fillers or do you do a mid-facelift? What do you do?
Well, you know, the nasolabial fold is a very complex thing. There's loss of volume, there's loss of structure, and there's sagging that goes into that. So we try and attack that with a little bit of this and a little bit of that to try to recreate and reformulate the way people used to look. And that's what I think is important. So the answer is we do all of that, but we do it in little volumes to make it look natural.
Do some people come in and say, you know, Dr. Keller, I need a facelift, and they really don't? I mean, do you ever have to talk somebody out of a facelift and do other things? I mean, does that ever happen?
There are those people, definitely. But I think people are becoming very well educated nowadays. And if someone comes in and says, I need a facelift, usually, not always, but usually it's true, they do.
Okay.
Yeah, because the tendency is to try the less invasive things first, and often people have gone through all of that and really want to accomplish something that restores their youthful appearance and the way they feel inside.